Seated workout, kidney-safe exercises for dialysis and mobility issues stop right there. When you woke up this morning, did you notice your feet or ankles felt heavy? Maybe that familiar slight puffiness around your eyes, or that persistent deep fatigue that no amount of sleep seems to fix. Perhaps you checked your blood pressure and saw that higher than usual morning spike. For too long, we've been conditioned to believe these frustrating daily occurrences are simply the cost of turning 55. We assume it's just getting old. But I'm here to tell you that these aren't just cosmetic signs of aging. They are often a subtle, silent scream from your kidneys, warning you that the filtration system is overwhelmed. I'm Dr. Mattheus from Kidney Health 365. My patients often share a common frustration. Their doctors correctly advise them to move more but rarely offer practical zero-impact solutions for days when mobility is limited or crucially while they are undergoing life-sustaining treatments like dialysis. The dangerous mistake is believing that if you can't stand or walk, you can't fight back against rising creatinine or dropping GFR. Ignoring the opportunity for gentle movement allows toxins and excess fluid to pool, placing intense silent stress on your kidneys and heart throughout the night. But here's the powerful truth: you don't need to run a marathon to protect your renal function. A pioneering study published by the American Journal of Nephrology focused on patients with mobility restrictions and showed that consistent chair-based exercises, just 15 minutes a day, could lead to an average reduction in fluid weight gain between dialysis sessions by 0.7 liters. That's a measurable kidney-protecting difference. The consequences of inaction, increased heart strain, worsening edema, and faster progression of kidney damage are too great to ignore. But the path to change is right here. Today, we're sharing a complete, safe, and effective 20-minute seated workout that proves you can actively improve your circulation and manage symptoms without ever leaving your chair. Are you ready to discover how just 2 minutes of gentle seated foot pumps can start flushing out that toxic buildup that happens overnight? Let's dive into why seated movement is the most overlooked secret weapon for your kidney health. Now that we've established why those morning symptoms are a sign of kidney stress, let's look at the incredible specialized benefits this seated routine offers. This isn't just about general fitness, it's targeted care. The first major benefit is circulation and fluid management. For many, managing kidney challenges or frequent dialysis, swelling or edema in the legs and feet is a daily reality. When you can't walk much, your body misses the powerful muscle pump that pushes blood and fluid back toward the heart. Seated exercises, particularly ankle pumps and gentle leg movements, mimic this muscle pump. They activate the calf muscles, gently squeezing the veins and helping to prevent that uncomfortable and often dangerous fluid pooling. Improving the circulation means less stress on your heart to deal with excess fluid volume. Secondly, seated movement is a crucial tool for managing fatigue and mood. It sounds contradictory, but light movement actually combats chronic fatigue. When you move, your body releases endorphins and boosts mitochondrial function, giving you a safe, sustainable energy lift. This positive impact on your mood is essential when dealing with chronic illness. It gives you a sense of control and independence over your health. Finally, even though you're seated, you're still actively working to control your blood pressure and blood sugar. Gentle, consistent exercise improves insulin sensitivity and helps your cardiovascular system operate more efficiently, easing that constant pressure on your delicate nephrons. As confirmed by the National Kidney Foundation, regular low-intensity activity is a cornerstone of managing both hypertension and diabetes, two leading causes of kidney failure. These benefits are within reach regardless of your current mobility level. To make sure you reap every single one of these rewards safely, we need to quickly go over how to properly set up your exercise space. So let's check your chair and your posture. Before we move, even a muscle setting up your environment is the first critical step toward a safe and effective seated workout. Since we are dealing with mobility concerns and managing kidney health, safety is always our priority. First, let's talk about the chair. You must use a sturdy, stable chair. Absolutely no office chairs with wheels; they pose a serious fall risk. Ideally, your chair should be armless, or at least have wide, flat arms that don't restrict movement. Sit toward the front edge of the chair so your back is straight but not leaning against the backrest. This slight forward position forces you to engage your core muscles, which is vital for maintaining good posture and balance. Crucially, your feet need to be flat on the ground. If your feet dangle, place sturdy blocks or thick books underneath them so your knees are bent at a comfortable angle. Next is posture and stability. Sit tall. Imagine a string gently pulling the top of your head toward the ceiling. Roll your shoulders back and down. This posture opens up your chest and allows for better breathing, which maximizes oxygen delivery to your heart and muscles. Throughout the routine, remember to engage your core slightly. You don't need a six-pack, just a gentle activation to keep you steady. Finally, hydration and supplies. Have your water bottle ready, remembering to strictly follow any fluid intake limits given by your doctor. Also check your RPE once more. Our entire workout will remain at a very light RPE of 1 to 3. This is gentle movement only. If any exercise causes pain, not just effort, but actual pain, please stop that specific movement immediately. With your chair secure and your posture perfect, we are ready to put this gentle power into practice. Let's not waste another moment. It's time to start our guided 20-minute seated routine. All right, the timer is starting and we are now beginning our seated warm-up. This gentle phase will last for 2.5 minutes. Remember, our goal here is to safely prime the body, gradually wake up the muscles, and most importantly, initiate that gentle fluid movement we need to combat ankle and foot swelling. Since we are seated, our RPE rate of perceived exertion should be a very light 1 or 2. Let's begin with seated marching, which is essentially gentle foot tapping in place. Keep your feet flat on the floor for now and simply alternate tapping your toes, then your heels. This is very small, very rhythmic movement. Focus on that good posture we established, spine tall, shoulders relaxed, and your core slightly engaged. This small movement is deceptively powerful as it starts activating the major muscle groups in your legs and helps prepare the venous system for the work to come. Continue this gentle marching rhythm. Next, we move to wrist and ankle circles. While you continue the gentle foot tapping, extend your arms slightly and start rotating your wrists clockwise. Keep the movement slow and deliberate. Now reverse that. Rotate your wrists counterclockwise. Good. Now we add the ankles. Lift your right foot slightly off the floor or keep your heel down and lift the toes. Start rotating your ankle clockwise slowly for a count of 5. Feel the motion, not the strain. Now reverse counterclockwise for 5 counts. Switch to your left foot and repeat the 5 clockwise rotations followed by 5 counterclockwise rotations. Synchronizing these movements, wrists and ankles, is a fantastic way to wake up the smaller joints and encourage better peripheral circulation, which is often impaired when managing kidney issues. Let's transition smoothly into shoulder rolls. Continue your gentle seated marching. Now bring your shoulders up toward your ears, pull them back and drop them down. 3 slow rolls backward. Feel the release of tension that accumulates overnight or during periods of prolonged sitting. Good. Now reverse 3 slow rolls forward. Relaxing the upper body helps ensure we maintain an open chest for deep, comfortable breathing throughout the routine. Remember to breathe deeply, inhale through your nose, exhale slowly through your mouth. For the final minute of our warm-up, we are going to increase the seated marching, just slightly. Instead of just tapping, try lifting your feet, one at a time, just an inch or 2 off the floor. We are not aiming for high knees, we are aiming for controlled, alternating foot lifts. This begins to activate the hip flexors and deep core muscles, giving you slightly more stability as we progress. Keep the movement flowing and rhythmic. Check your posture again. Are you slouching? Sit back up tall. This slight increase in muscle contraction is the perfect signal to your body that it's time to work. We are just about finished with our seated warm-up. You should feel slightly warmer and your muscles should feel prepared and mobile. We are now going to transition into the lower body and circulation boost. This is where we focus specifically on the largest muscles and the fluid pump action that is so crucial for managing edema and supporting your kidneys. We are now moving into the most critical part of this seated routine, the lower body and circulation boost. This 5-minute segment is directly targeting the areas most affected by fluid retention and limited mobility. We are going to activate those muscle pumps that work so hard to fight edema and support your heart. Our first movement is knee extensions. Sit tall away from the back of the chair.
Slowly extend your right leg straight out in front of you, flexing your foot as if you were pressing against a wall.
Hold that extension gently for a count of 2, feeling the engagement in your thigh muscle, your quadricep. Now lower the leg slowly back to the floor. Repeat on the left side, extend, hold for 2 and lower. We will alternate legs, aiming for 10 repetitions on each side. Remember, controlled movement is essential. Do not swing your legs or use momentum. This controlled muscle contraction is paramount. It builds leg strength gently and, more importantly, improves the local circulation in that limb, encouraging excess fluid to move out. If you feel any strain, reduce the height of the lift. You are strengthening the largest muscle group in your body, even while seated. We are 2 minutes into this segment. Now let's transition into heel and toe raises. This exercise is purely about that powerful circulation pump. Keep your feet flat on the floor. First, lift your heels as high as you comfortably can, keeping the balls of your feet and toes grounded. Hold for 1 second, feeling your calf muscle squeeze. Lower, slowly. Now reverse, lift your toes as high as you can, keeping your heels firmly planted. Hold and lower. We will alternate between heel raises and toe raises for 1 full minute. This pumping action is exactly what your veins need to prevent blood and fluid from settling in your ankles, a major concern for kidney patients. Think of your calves as a second heart, gently pushing blood upward. Next up, we have seated leg abduction. If you have a chair without arms, or if the arms are wide enough, slightly move your knees and feet outward, opening your legs just a few inches. Hold that position for 2 seconds and then slowly bring them back together. We are doing 10 repetitions. This subtle movement engages the muscles on the outside of your hips, which are crucial for stability and mobility when you eventually stand up. It's a small movement with huge benefits for hip joint health and balance. We have about 1 minute left in our lower body boost. Let's return to our knee extensions, 10 more alternating sides. Extend the right leg, hold lower. Extend the left leg, hold lower. Focus on keeping your upper body perfectly still. All the work is happening below the waist. This final effort maximizes the pump action, ensuring your lower limbs are energized and that circulation is optimized before we transition. Excellent work. You have successfully activated the core muscles responsible for fighting fluid retention and maintaining lower body strength. Now that we've taken care of our foundation, let's move our attention upward to improve posture and mobility in the upper body and core. Now that we've energized your lower body, let's focus on the upper body and core. This 3-minute segment is vital for improving posture, releasing tension in the neck and shoulders, and maintaining the core stability that protects your spine, all crucial, especially when spending time seated for treatments like dialysis. We begin with seated arm circles. Extend your arms straight out to the sides, level with your shoulders. Start tracing small, slow circles forward. Keep the movement small and controlled. We are not looking for speed here, but rather intentional, gentle activation. Do this for 15 seconds. Feel the movement originate from your shoulder joint. Now reverse the direction, trace small, slow circles backward for 15 seconds. Remember to maintain that tall, seated posture. This exercise helps improve the range of motion in your shoulder joint, combating the stiffness that often comes with limited mobility. Next, we move to the chest squeeze. This is fantastic for correcting that forward slouch. Bring your arms up so your elbows are bent at a 90-degree angle, palms facing forward, almost like goalposts. Now gently squeeze your shoulder blades together behind you, pushing your chest slightly forward. Hold this contraction for 3 seconds. You should feel tension across your upper back, not pain. Release the squeeze slowly. Repeat this motion 10 times. This simple exercise directly targets the postural muscles and helps open your airways, promoting better, deeper breathing, which is beneficial for overall heart health. We are halfway through this segment. Let's focus on the core with seated twists. Keep your feet flat on the floor and your hips anchored to the chair. Place your hands gently on your thighs. Slowly rotate your upper body to the right, using your core muscles, not just your arms. Hold the gentle twist for a count of 2. Come back to the center slowly. Now rotate to the left. We will perform 10 alternating twists. This movement improves spinal mobility and engages the stabilizing muscles around your abdomen, which are key to safely transferring weight when getting up or sitting down. Throughout the twist, keep your neck relaxed and follow the direction of your torso. Let's finish this section with 10 more slow, controlled chest squeezes to cement that improved posture. Squeeze the shoulder blades, hold and release. This deliberate action helps your body learn to hold itself in a better position, reducing strain on your lower back. You are doing a phenomenal job. Every small contraction is a step toward greater independence and comfort. We are seamlessly transitioning now into our active recovery phase. Do not stop moving. This 1.5-minute active recovery phase is vital for cooling down your major muscle groups and safely stabilizing your heart rate after the strength work. We are going to consciously drop the intensity back down to that RPE of 1 or 2. We want your body to know that the main work is finished and it is time to relax and recover. Immediately transition back to gentle seated marching. Your feet should be just tapping the floor or lifting only an inch or 2. The movements are slow, rhythmic, and effortless. Focus entirely on your breathing. Inhale deeply through your nose, expanding your stomach gently. Exhale slowly and completely through your mouth. Controlled deep breathing helps regulate your autonomic nervous system, moving you out of the fight or flight stress response and into rest and digest mode. This gradual return to rest minimizes stress on your cardiovascular system, which is paramount for kidney-safe exercise. As you continue this slow march, conduct a quick body scan. Check your shoulders. Are they still tense? Drop them down. Check your jaw. Are you clenching your teeth? Relax your facial muscles. Notice any area where you might be holding tension and use your exhale to release it. This mental check-in is just as important as the physical exercise, as stress management is deeply tied to blood pressure control. We have about 45 seconds left in this active recovery. This is your chance to simply enjoy the feeling of having completed a powerful workout safely. You have taken control of your mobility and actively supported your circulation. If you are feeling comfortable, continue that slow-seated march. If you need a complete rest, stay still and focus solely on your deep breathing. Remember our primary goal: consistency over intensity. By choosing this gentle seated routine, you have chosen sustainability and safety. Excellent. The active recovery period is coming to a close. We have achieved the maximum benefits from our movement phase. Now, to prevent stiffness and prepare your body for the rest of your day, we must move into our final segment of therapeutic stretching. Keep your body relaxed and your breath slow as we transition smoothly now into post-workout stretches. You have successfully completed the movement portion of the KH160 routine. Now we move into our essential final step: post-workout stretches. This stretching phase, lasting about 90 seconds, helps improve flexibility, prevent muscle cramping, and signals to your body that the work is completely done. Remember, we only hold gentle tension, never pain. Let's begin with the figure 4, stretch for the hips. While seated, lift your right ankle and gently cross it over your left knee. You should feel a stretch in your outer right hip. If this position is too intense, simply cross your legs at the ankles instead. Keep your back straight, breathe deeply, and hold this gentle stretch for a slow count of 15. The hips can become very tight from prolonged sitting, and releasing this tension is key to better mobility. Release slowly, and now let's switch sides, crossing the left ankle over the right knee. Hold for 15 seconds. Next, we release tension in the neck with neck tilts. Keep your shoulders relaxed and down. Slowly and gently tilt your right ear toward your right shoulder. You should feel a very mild pull along the left side of your neck. Use your breath to deepen the stretch slightly. Hold for 10 seconds. Come back to the center slowly. Now, tilt your left ear toward your left shoulder. Hold for 10 seconds. Always keep these movements slow and controlled. Finally, the overhead side reach to stretch the torso. Raise your right arm straight up overhead. Gently lean your upper body slightly to the left, reaching over your head. Keep your hips firmly planted. You should feel a nice opening along the right side of your torso and rib cage. Hold for 10 seconds. Release and repeat on the other side, left arm, up gently leaning to the right. This stretch helps maintain flexibility in your spine and core, which supports your posture. Wonderful job. Your muscles are now relaxed and your heart rate has stabilized. There is only one final crucial action left to complete this kidney-safe workout and maximize your recovery. You did it. You successfully completed the entire 20-minute seated workout, actively fighting back against the challenges of limited mobility and chronic kidney stress. Before you move on with your day, let's address one final critical component: hydration. Please take a few slow, careful sips of water now. This replenishment is essential for aiding your body in circulating the fresh blood we just moved and helping your kidneys process toxins. A crucial reminder: if your doctor or care team has placed you on strict fluid restrictions, you must adhere to those limits closely. Today you learned that even small intentional movements done from a chair are a powerful tool for reducing fluid retention, boosting circulation, and combating chronic fatigue. You proved that limited mobility does not mean limited power over your health. This gentle routine is your consistent defense against the silent progression of kidney decline. And that is why starting today matters. Kidney conditions, like many chronic illnesses, rarely announce themselves loudly until the damage is significant. Postponing this simple exercise means allowing fluid to pool and toxins to accumulate, forcing your heart and kidneys to work harder than they should. Don't wait for symptoms to worsen. Remember, every chair tap, every ankle circle, every gentle stretch is an act of empowerment. You don't need a gym membership or hours of free time. You can improve your health and energy levels right where you are using only your own body weight in a stable chair. Believe in the power of these small, consistent steps. Your next steps are incredibly simple. First, immediately commit to doing this routine again, tomorrow or during your next dialysis session, if applicable. Second, share this video link with one person you know who struggles with mobility. You might just change their life. Finally, remember that this content is for informational purposes only and is not a substitute for professional medical advice. Please consult your nephrologist or physical therapist before starting any new exercise routine to ensure it is safe for your specific condition. If this workout helped you feel stronger and more energized, please hit that subscribe button right now and turn on the notification bell so you don't miss our next video. We recommend watching this video here on the screen about incorporating gentle hand and grip exercises into your daily routine. Thank you for making movement a priority, and we'll see you next time.